The first step in being prepared for a severe allergic reaction, also called anaphylaxis, is having an EpiPen on hand at all times. But your EpiPen won't do you any good if you don't know how to use it. Take some time now to become familiar with your EpiPen, so should you need it, you'll be ready. For starters, you should be aware of the symptoms that you may experience during a severe allergic reaction. These can include hives, swelling and itching, shortness of breath or chest tightness, cramps, nausea, vomiting or diarrhea, a sharp drop in blood pressure, and if you don't act quickly enough, you could even lose consciousness. Epinephrine by injection is the treatment of choice for anaphylactic reactions because it quickly begins working to constrict blood vessels, relax muscles in the lungs to improve breathing, stimulate the heartbeat, and reverse hives and swelling around the face and lips. Your EpiPen contains a single, pre-measured dose of epinephrine. Using your EpiPen is easy. First, remove it from the plastic tube. Grasp the unit with your dominant hand. Your thumb should be closest to the end with the gray safety release cap, but not over the cap. Then use your other hand to remove the safety release cap. Once the cap is removed, be sure not to touch the black tip at the other end of the EpiPen. This is where the needle comes out. Hold the EpiPen with the black tip toward your outer thigh. Now, swing and jab the EpiPen firmly at a 90-degree angle into your thigh. Your EpiPen is spring-loaded and is designed to be used through clothing. Keep the EpiPen firmly against your thigh for approximately 10 seconds. Then, remove the EpiPen and massage the injection site for another 10 seconds. Check the small clear window on the side of the EpiPen. If you see the red plunger in the window, it means that the epinephrine has been injected. Also, look to see if the needle is coming out of the black tip. Next, take your used EpiPen and without bending the needle, carefully put it back into its plastic carrying tube, needle end first. Then screw the cap on completely. This will automatically lock the EpiPen into the tube for safety. It's important to remember that once you've used your EpiPen, you must seek medical attention. Call 911 immediately or have someone else take you to an emergency room as soon as possible. This is crucial because after 15 to 20 minutes, the effects of epinephrine begin to wear off. Remember to take your used EpiPen with you to the hospital and be sure to give it to your physician for inspection and proper disposal. Before leaving the hospital, be sure to ask for a new EpiPen prescription. It's also a good idea to see an allergist as soon as you can. For more information about EpiPen, visit our website at www.epipen.com. Once there, you'll have an opportunity to sign up for the EpiPen Center for Anaphylactic Support, your free information resource for severe allergic reactions, where you'll find valuable offers and tips to help you stay prepared. Remember, you can't always predict when you will have a severe allergic reaction, but if you have an EpiPen with you, you will always be prepared. EpiPen is indicated for emergency treatment of allergic reactions, also known as anaphylaxis, for people with a history of an anaphylactic reaction. EpiPen should be used with extreme caution in people who have heart disease. Side effects of EpiPen may include fast or irregular heartbeat, nausea, and breathing difficulty. Certain side effects may be increased if EpiPen is used while taking tricyclic antidepressants, or MAOIs.